All right, today we're tackling something millions of us do probably without even thinking about it: mouth breathing. Yeah, it seems pretty harmless, right? Just breathing. But as we're about to find out, this little habit can have some surprisingly big consequences for your oral health and even your overall well being. So let's unpack what's really going on when your mouth takes over the job of your nose. So let me ask you something. Do you ever wake up in the morning and your mouth feels just incredibly dry, like a desert? Or maybe you feel like you're in a constant battle with bad breath, even with all the brushing and mouthwash in the world. If you're nodding along right now, you're definitely going to want to hear this because those are textbook signs of mouth breathing. And look, this isn't just about some minor inconvenience. We're talking about a real health risk here. This can spiral into things like cavities, gum disease, and get this, it can even affect how your face develops, especially in kids. It's a much bigger deal than you might think. So first things first, what exactly are we talking about when we say chronic mouth breathing? Now, to be clear, we're not talking about those times you have a nasty cold and your nose is completely blocked. I mean, that's just survival, right? We're talking about chronic mouth breathing. This is when breathing through your mouth becomes your body's default setting, your go-to method, day in and day out. And more often than not, it's a huge red flag that something else is going on under the surface. So, why does this even happen? What makes someone a mouth breather? Let's get into the root causes. Well, the reasons are actually all over the map. It could be something simple and temporary, like nasal congestion from allergies or a sinus infection. But then there are the more permanent structural issues, things like a deviated septum. That's basically when the wall inside your nose is crooked, or enlarged tonsils and adenoids, which you see a lot in kids. And here's the kicker. Sometimes there's no physical blockage at all. It can be tied to things like sleep apnea, or it can simply become a deeply ingrained habit that's really tough to break. Okay, so how do you know if you're a chronic mouth breather? Well, besides the super obvious stuff like a dry mouth, bad breath, and snoring, which, let's be honest, might be more obvious to your partner, you might also notice things like constantly cracked lips or a buildup of dental plaque. And this one might surprise you, it can even mess with your ability to concentrate, all because you're not getting good quality sleep. All right, so what's the big deal, really? Why does it matter so much? Let's dive deep into exactly how breathing through your mouth wreaks havoc on your teeth and gums. Okay, this chart really lays it all out. Your nose is, frankly, a masterpiece of engineering. It's a natural humidifier, it filters out gunk from the air, it's designed to protect your mouth's ecosystem. Mouth breathing, on the other hand, it's like leaving the front door wide open. It completely bypasses that filter, dries everything out, and basically rolls out the red carpet for harmful, acid-loving bacteria to set up shop. I love this domino analogy because it's so perfect. It's a chain reaction, right? The first domino to fall is the mouth breathing itself. Wham! That immediately causes your saliva production to tank. The next domino? A constantly dry mouth. That dryness then lets acids and bacteria run wild, and that knocks over the last, biggest domino. Your risk for cavities and gum disease just skyrockets. But the fallout doesn't stop in your mouth. And this next part, this is so important, especially for any parents watching. That poor, choppy sleep from struggling to breathe all night means less oxygen and no deep, restorative rest. In kids, this can show up as difficulty concentrating and other behavioral issues that can look a lot like ADHD. It's something to really be aware of. And it goes even deeper than that for kids. See, when you breathe through your nose, your tongue naturally rests on the roof of your mouth. This pressure is actually essential for helping the upper jaw grow wide and strong. But with mouth breathing, the tongue drops down. Over time, this can lead to a narrow palate, a longer facial shape, and crooked teeth, which usually means years of expensive orthodontic work later on. Okay, I know that was a lot of pretty serious information, but here's the good news, and it is good news. This is totally a solvable problem. So let's switch gears and talk about what you can actually do about it. You can actually start making a change right at home, and some of these are really simple. Things like saline sprays or those little nasal straps can help open things up. Some people swear by mouth tape. It's a special tape that gently reminds your lips to stay closed while you sleep. And of course, just running a humidifier at night and making sure you drink enough water can make a huge difference. Now, if the home remedies aren't cutting it, it's time to bring in the pros. The right solution really depends on what's causing the problem. It might be medical, like antihistamines to tackle allergies. It could be dental, maybe with orthodontic devices. In some situations, surgery might be needed to fix a deviated septum or remove tonsils. And then there's this really cool field called myofunctional therapy. Think of it like physical therapy, but for your mouth, tongue, and facial muscles, retraining them to breathe the right way. Okay, let's pull all of this together into a simple, healthy breathing plan you can follow. So here's your checklist. First, get a handle on any allergies or sinus problems. Keep up that great oral hygiene. Brushing and flossing are non-negotiable. Always have water with you. But the most important things on this list? Get to your dental checkups every 6 months. And please, don't be afraid to bring this up with your doctor or dentist. They need to know. So who do you even talk to about this? A dentist? A doctor? The truth is, you probably need both. Think of it as a team approach. Your dentist is on the front lines, managing the damage, the dry mouth, the cavities. But your doctor, or even better, an ENT specialist, is the detective who's going to figure out the root cause and treat that. So here's the bottom line. Mouth breathing isn't just some weird little quirk. It's a signal flare from your body that something isn't right. Now that you've seen how all those dominoes can fall one after another, the real question is for you. Is it time to have that talk with your doctor or dentist? Trust me, your smile and your sleep will be so glad you did.